And yes, it is night and day. So it's a bittersweet. Of course, we all love our hospital. We love Dorchester. It's a lot of memories there. Many families have been, children were born there. I saw the last patient off. I recorded the ambulance leaving the site. Obviously not the patient, but the ambulance, and it was definitely bittersweet. I was there when we turned off the lights. However, this is very exciting to me to have a brand new building with, we had curtains, we have walls, and doors that close and all those kinds of things. The downstairs, which is regulatory, and the upstairs, which is unregulated space. So outpatient, you have your pediatricians, you have your cardiologist, you have women's services, you will have a separate and independent outpatient radiology department, which means that now, before in Dorchester, if you had an inpatient and an ER at the same time there, we kind of had to fight for the space. Not fight, but we had to, work out who needed to prioritize. So the good thing is outpatients will not be waiting on emergency patients, and emergency patients will not be waiting on outpatients. We were giving up a smaller hospital that had minimal resources compared to some of the bigger places. We were able to condense and enrich the resources that are at Easton, which is where those same patients will go. They'll see the same nurses, the same doctors that would have treated them here, will treat them there. And we've brought in all kinds of outpatient services. So our community no longer has to travel to Easton or Salisbury to get all the services, that's neurology, urology, cardiology, all these services that we're now offering right in our community. So I can tell you the patients that have been here have been very excited about having walls. When a lot of patients have chronic illnesses, so we see them a little more often, and they've come in and been very excited about having their own private room, and there's more bathrooms, which seems like a silly thing, but it's a big thing. The staff themselves are very thankful to have that extra space. The rooms are very large. They're not confining at all. They're much larger than what we're used to. We now have our previous ER, we only had one negative pressure room, and I did say this on the news as well, but we now actually have 6 in this building, 4 in the ER, which that's all COVID. We do also have 3 behavioral health beds that we're working on building up so that we can have that as a separate little behavioral health pod. And we also have an observation unit, which is 6 beds, and we're working on getting that up and going as well. The patients can be in observation status and still be in the ER. However, we do have a 6-bed observation unit that's brand new. So that people